Hi, this is Dr. Nguyen from Kudo Care Center recording this training video for X-ray machine operating. Number one, you need to have this green light lighting up, which means changing in the battery. And then depending on what protocol you have, you can put either the plate in the table or in the bucket. If you were looking for the abdominal view or KUB, or even the hip or femur. Otherwise, if arm and foot, you might not need for it to be in the table bucket. And of course, for the chest, you will need to be in the wall bucket, which is gonna be over there. This is the distance, usually about 40 for the table. As you can see, if I move the table up and down with using the button back here. When I press the button back here, you'll be able to move the x-ray up and down and then measure it. And then, so these are the setup. Make sure the light is on. The light is on by putting the new battery in. And same thing with the wall bucky. When you actually pull it out and put the plate in here, let's say if the patient is too big, you can actually turn it to the side and tack it a Y um, film. And so in that case, then you might have to tack two from two shot. One is to get both, and then take another shot higher if the patient is too large for you. And then after that, you need to make sure that you go in here. First of all, when you change the battery from here, this is a chargeable battery from the other battery. When you change it, make sure you change it first and then you turn on the computer. This is after you log in. And I'm going to just put the test in here to make sure that we have a test patient. And I'm going to put today date as a birthday right here. You can see this is a military date, and then you click on the little button right here, say protocol. Make sure that you pick the either baby, thin, regular, or overweight, and male or female. So for our study purposes, we'll pick the male. And then we'll click here, and then the icon of the person will come out. And depending on what you click, let's say you click on the head, then all the protocol for the head will come out. If you click on the chest, protocol for the chest will come out. Let's just say we do chest PA and lateral, then that how you position it. But for our test purposes, we're going to use this arm of hand. And if you want to delete one of these, you can actually go in here and click delete. It'll delete, and you just use hand. And then after that, you make sure that you go over here and turn on the collimator, and it already preset with the set up here. With the hand, it will be for the thin patient is 60 and 1. So you go down here and you click 60 and 1. And you click it down to 60. And here you click 1. And then you push this button right here. Make sure you push it all the way down and watch the light. Excuse me, I just need to go back here, and actually you have to start the exam before it started. So when you start the exam, you can turn this off and back on again. And now you're ready, and you wait for this to booth. And when it booth, you can actually start the x-ray. So we're going to go to upper extremity and then hand. And we just turn it to 60 and down to 1. And now you push this button and you watch the light. Once the light flashes, you can let go. And this is our test result. Thank you so much. If you have any question, please email me. In fact, sorry, you have to put in this KV they will ask you, and it'll be 60 and 1. And then click OK. You can use left or right to label the label, and that's it. And accept. Thank you.